Hello, friends. Welcome to Feeling This Life. We're a family support podcast that dives deep into the triumphs, challenges, and strategies that are part of the lives of those who care for children with blindness and visual impairments. I'm Paige Maynard, and I'm a teacher of the visually impaired and an early interventionist at VIPS, Visually Impaired Preschool Services.
And I'm Dr. Cathy Smith, and I also have been a teacher of students with visual impairment for many years, and now I am the Director of Research at Anchor Center for Blind Children.
I am jcastenir, and I am the Family Services Coordinator at VIPS. I am the mother of 3 girls, and my youngest has a visual impairment.
Amanda Jaksha is a mom to Ava, who is 17, and Eliza, 13. They all call Colorado home. She's a patient advocate dedicated to rare developmental and epileptic encephalopathies, which is DEE, and she holds a BS in accounting as well as a certified nurse aide license. She's passionate about multidisciplinary clinical care, early identification for interventions, and rare disease drug development. And I'm happy to say that she and her daughter were one of my very early intervention. So she's a mom that I've known for a long time, probably longer than I should say. Well, obviously, 17 years. So welcome, Amanda. First, please tell us a little bit about you and your daughter, Ava.
Great, thank you, and it's great to be here. Ava was born a very healthy baby girl. She was 8 pounds and 4 ounces, and she had very few indications when we left the hospital that things were going to maybe not go quite like we had planned. When Ava was around 6 months old, we were at her well child visit, and her doctor started to ask me about her vision. And he wanted to know if I thought Ava could see. And I hadn't really thought much about if Ava could see or not, or the questions he was asking. And up until that point, she had hit milestones in a normal fashion. We went home from her 6 month, and I had committed to just thinking about some of the things he had said and making some observations. And less than a month later, Ava started having seizures. And at that time, they started, any of you familiar with infantile spasms understand the trajectory of how things can really ramp up quickly. So within the course of probably a few weeks, we went from having some clusters of very short spasms to like 17 to 22 minute episodes of clusters of seizures.
I remember when you sent me some of the early video that you had taken of her having a seizure. So I think that's something that parents should think about if you're having concerns about. Yes. Is my child having seizures or is something wrong? Use your phone and do that video because It was really helpful for us and for the doctors, I think, right?
Oh, absolutely. And I think that even generalized, your pediatricians and stuff are sometimes not even going to recognize. Oftentimes it's confused with reflux. When you're a baby, they have a certain name they call reflux. So yes, video and seizures don't look like you think when infantile spasms is part of the picture. I, in hindsight, she might have been having little spasms where maybe just the hand would move and she'd turn it and look at it weird. Looking back for longer than I had caught on. Mm. And she was also a little hypotonic. It was hard for her to breastfeed in the beginning. So that was one early sign that everybody was like, oh, she'll get better. Don't worry about that kind of stuff. So
tell us what hypotonic means.
And hypotonic means she was floppy. She was a little loose.
Okay.
But she wasn't loose in a way that is consistent. She had very strong core. And so it confused people who see normal babies.
Okay.
And so with that being said, after having seizures and being identified as literally having seizures, they ruled out, things that are immediately need to be addressed, brain tumors, things of that nature. And they sent me home with a referral to get vision services and early intervention.
And that's when she started to see
That's
me.
when I met Cathy. She was literally the first interventionist that walked into our home and assessed Ava. A PT, I think, came next, but they still were not really as concerned about physical therapy as they were about her vision. And fast forward to today, Ava's, in a high school. She's in a center-based classroom, but it's about 1,800 kids. It's a huge, busy environment, and she can use eye gaze to tell you what she thinks, and she continues to slowly develop new skills and executive, function. She can also problem solve a little better than we ever imagined she would be able to. So,
Wonderful.
Early on, everything seems like it's just this mountain, and it is a mountain, but it's kind of like you're going to keep climbing these mountains, right?
Yes.
You're just working your way through.
Yeah, I would say you've become quite the mountain climber.
You're the mountaineers,
but a competent one, so helpful.
Yeah.
So what were some of the surprises that you were not expecting as you learned more about her diagnoses?
So it took 7 years to diagnose Ava. I think that the standard today for early seizure kids is, I see kids 4 and 6 weeks old getting diagnoses like this. And I don't have that experience, and I'm not sure how devastating it would have been to hear such news at that young of an age.
And hers is a diagnosis, a genetic
diagnosis, yes. Okay. Ava has, I'll back up and I'll tell you, she has a small deletion on a gene called CDKL5. So it is known as CDKL5 deficiency disorder, and it's similar to Rett syndrome, Angelman syndrome. It's kind of a mix-up of maybe those two disorders that are maybe a little more commonly known. So, the gene that causes her problems was just found in 2004, I believe. And then she was diagnosed, born in 2005 and diagnosed around 2012. So within that diagnostic journey, I had learned a lot about CVI. I mean, it really was what we focused on. It's the one diagnosis she had that we could intervene in.
And that's the vision diagnosis.
That's
so
the cortical vision impairment. Yep. It's the only thing we had to work with. I read epilepsy journals back then because finding pediatric epileptologists, getting into level 4 epilepsy centers, it was months and sometimes years of waiting. So I just kind of did all I could to prepare myself, read blogs. We were a bunch of parents out there blogging, and, very thankful that the parents before us went to libraries and, brought the world far enough along that we could sit at home and blog and learn about things and interventions and, CVI. So, fast forward to 2012 when she was diagnosed, and she was almost 7 years old, and I joined Facebook because there was a parent support group. And I got into the parent support group. And the first thing I wanted to know is whose kid uses a cane in here? And I had all of these questions that had to do with vision, and it was crickets. And I learned that there was probably about 200 of us in that group. And I learned very early that nobody had figured out CVI was part of CDKL5. And oftentimes the CVI characteristics were being kind of tossed off to maybe autistic-like characteristics. So, really thinking these kids weren't looking at you because they didn't want to, instead of realizing, they were looking away to, literally interact or do what you were asking them to do.
So so the question was, is it a cognitive issue as opposed to a visual issue?
Right.
And so that's the conversation, and I still think that is a viable conversation that we haven't figured out yet, but certainly.
Yeah. I mean, it's yep.
Yeah.
And today I would like to say that we know at least 85% of kids, and we suspect about 95% of kids with CDKL5 have CVI.
Oh, interesting.
So it's really
So that being said, can you tell us what was some of the most valuable information you learned in your journey? Would you say that's the blogs or and which individuals helped you the most?
Well, eventually I learned I wasn't going to fix it. And I think that's really some of the best advice I can give anyone is it's not going to go away. You're not going to fix it. So you got to learn how to manage it. And in the early years, I spent a lot of time at the Anchor Center for Blind Children in the Denver, Colorado area. And I think being in a center like that did multidisciplinary therapy and really gave us skills to take home, gave us skills to, they had a great psychologist at the time that was there who actually also, kind of walked us through what we needed to in a group therapy setting, whether we wanted to or not. And that paired with the mentoring of how to, introduce therapy into your daily life, as well as the education on, just transitioning out of EI and into the school system, that really did wonders for me. It's very complex disability, and even just accessing things like secondary Medicaid, which is, for those of you listening, if you have little ones and you think you make too much money for Medicaid, you don't, because there are waivers out there, and there are things you should be doing now to try to get your children access to services that are just out of your reach without it. So, I think my peers taught me a lot, but I also think that the therapists who take the time to get to know you, that understand literally your home environment versus, your school environment versus your, even your EI environment, I think they help kind of steer you and manage those expectations and gently walk you into the next phase of transitions.
You can do this. You can do this without us.
Yeah, you can. I mean, I literally, preschool transition, it was tough. So it was very tough to let go and let her go into, a little bit fuller day, a little bit further away from me. And it was very, my heart always goes out to all of you doing your EI transitions. And, life becomes another transition.
You did find some wonderful providers for her, even as she got older, I know. And so I think it's hard to take that step, but that doesn't mean that there aren't good people out there.
No, and there are good people, and even the schools. It's complex. There's fun. It's a challenge everywhere, and none of us are really in control of that challenge. Sure. So it's really, you got to advocate, and you got to do it with grace, and that's a whole nother road to. To acceptance and learning and growth, I should say. It's another growth milestone. But
so I'm going to ask part of this question, but I think you've already answered part of it. So how did you manage all of Ava's therapies and appointments when she was in early intervention? And do you have any advice for new parents? I know you've just said that get started on that Medicaid waiver right now, but anything else?
Get started on Medicaid. Involve any of your family that will come to a therapy session with you. Let them come, make them come, however you get them there. Help them see, the value of putting in the work. Take a break from therapy when you need to. Take a break at one modality of therapy when you need to. I know my daughter still has, speech, OT, PT, we do music therapy. We still have a lot of therapy weaved into our life. And we, I've learned that if something's not working or if I'm not lined up with the provider, that we can take a break. And that might even be a year. It might be 2 years. It might be, we took a break. We went and got, scoliosis surgery and decided we were going to go back to hippotherapy. So, take a break, and you may be surprised at what your kid does once you take that break. They really are paying attention in therapy, and sometimes stepping back helps you in them kind of develop and use those skills.
Yeah, I think that's great. Yeah, take that vacation. It's okay to have a vacation. You don't have to. The world is not going to come to an end if you.
Yeah, I think back to
take
that,
a week.
It, right?
Yeah, it's like. Yeah. If I miss this weekly therapy, it's she's never gonna get caught up, and maybe she's never gonna get caught
maybe
up.
she's
so
never
it's
gonna
okay
get,
to take that vacation.
And also, one thing that we shift from, I was a professional, I had a full-time job, I had never ever envisioned myself being at home, and here I am 17 years later, still at home, and I think that moving swiftly into EI, especially if you're new at parenting. I mean, really any time, it's not your job.
Right.
Like, you do not have to put the pressure on yourself. I mean, think about it differently. Don't think about it as like, I'm not at work, so I have to be doing this, because I think a lot of us struggle with how do you move from being a professional that, you really needed that second income at home. There's just a lot of adjustments you're making. So they're not your job, they're your kids. And when it feels like it's your job, like, give yourself the grace to step back and, readjust your priorities.
Absolutely. So if you knew what you know now about Ava, what would you share with medical and educational providers when she was very young?
I think what I would share was she'll do it in her time. And I think that no matter, and probably that's something they might have wanted to share with me, but I think often medical providers might not respect in their time, and they might just say, never going to do it. And I think that you don't ever give up that hope or that idea. I know within her community, I've met boys who walked when they were 21 years old. It's like, let your child write their own story. Don't be boxed in by the expectations of, anyone. And the medical people and her teams that I have and that work with her are fantastic. They're some of the best experts in the world. They're very humble in what they don't know, because they realize they don't live with these kids every day, and that when they sit there for 15 minutes in a visit, they can't possibly know all the kid is or isn't capable of, or what trajectory anyone's going to take. So give them grace. They practice medicine. And a lot of our kids that are young and have vision issues are, it's a long road, and it's very uncharted still.
Yeah, uncertain what's going to happen.
Yeah.
Always be happy for what, celebrate
the inch stones is what we say, right? Like, you just celebrate, and even good days.
Yeah.
And we talk a lot about just good day, bad day.
Absolutely. So we're starting to wrap it up here, although I know there's lots of other things that I could talk to you about. But do you think there's anything else you'd like to make sure to share with us before our time is finished?
I think early intervention goes fast. So even though I say take breaks, also take advantage of the robust funding that goes into early intervention, and don't let people tell you, oh, just give it a few more months before you get PT in here, or, at least take advantage of assessments or things that you can learn about your child, and that will definitely, help you set them up for success, and also just continue to transition through their programs in a much, a much calmer and more informed place.
Yeah. I know you're very active in the CDLK5 group internationally and nationally. And do you think that has helped you learn more, helped you?
Honestly, yeah. I think when I sit back and think about my world community, in the United States, we have a lot of emphasis on our medical system. We have very little emphasis on our social system. So my friends in Europe, their quality of life is a lot different than mine, because they have these beautiful respite homes, and they really take care of their kids. They have equipment that we really like. We loathe them for their equipment. I mean, I'm kidding, but they really do.
You're jealous.
No, we are very jealous of them, and it's it's a lot of how you think about your situation and how you frame the way you feel about it is. It could really change the way you live your life every day. So, back to, you're not fixing it, but you can fix the way you think about it, and you can adjust your goals to be more along the lines of a quality of life matrix versus a fix it matrix, I think.
Instead of how well is she doing, how well are you all doing? So how is the whole family
unit
dealing with everything, and how will you deal with it in the future? So this podcast is definitely focused on early intervention, but you always have to be thinking about what happens next.
We do. We literally are starting to talk that at 8 years old is the time we should start preparing people for adult transitions, because of how long certain things take about letting, So,
interesting.
Yeah.
All right. Well, thank you so much, Amanda, for your time today. We appreciate that you're willing to share your journey with us. And we know that many families are learning to navigate the system for their children with visual impairment and complex medical needs, and that your advice will be valuable.
Thanks for having me.
So this was a really fun interview for me to do. I've known Amanda and Ava for a very long time. I want to start out by, I always try to give some insight into the research. And for CDLK5, there is quite a good research, clinical research. There's several clinical research trials going on. And what's exciting is that Amanda has always been very focused in that arena. She participates, she goes to conferences. Ava is in several clinical trials. I'll get an article occasionally from her about how the research is going, and sometimes things are going well and sometimes they're not. I think it's important for this podcast to talk to people, is that's one of the ways that Amanda in the past has managed all that's going on with Ava. That's what she feels she can do to contribute. But not everybody has to do that. So it's also important to just be Ava's mom someday and not the person who's participating in the trial. So you can do both, you can do neither. So what do you ladies think?
I was just thinking, I wrote down some quotes while I was listening to her talk, and I loved how she said, they're not your job, they're your kid. And it really is just so true that sometimes it can feel like there's therapy every single day, or every day is really hard to get through, or there are just so many roadblocks in your way. But if you are able to, even just if it's for a moment during the day, just take joy in who your child is and all of the things that they bring into your life and all the things that you can be to them just as their parent that loves them. I really like that that's one of the things that she said.
I like that she said that too, and how she talked kind of in that same time about not trying to fix her child, but manage it. And Cathy mentioned how, she does all the research and participates in that to manage it. But I think just to really think about how, like, it's not, a lot of times it's not something that can be fixed. And so you're not looking to fix it. And it kind of reminded me of Brooklyn's episode in season 1, where she talks about not thriving. And it really reminded me of that you want to be their parent. They're still a child. This is still your family. And even though it can't be fixed, you can still have your family life. They're still a child and you can still be their parent.
Absolutely.
And I like that sometimes there are a lot of things that we cannot control. We can't control what is going on from a health perspective sometimes with our kids and things like that, or what their visual impairment is, or all those things. But I love how she said that you can fix the way that you can think about it. Like, you have control over your perspective about it. And I feel like that can be really, really freeing to be able to think about it that way and know that you do have control over the way that you view it, and choosing to be thankful and finding the good parts of it.
Yeah, I love how positive she is just about the whole situation, but even how she talked about giving doctors grace, because that can be so frustrating, because you want the answers and you feel like they're the only people that can give it to you. But she's right. They're seeing them in a medical setting. A lot of times they're asking them the same questions over and over for years. Smart kids can memorize that. They know what they need to do when they walk in, and let's just get it done and go home.
So I love how she says that they're practicing medicine. So
Yes.
doctors are practicing medicine.
Yes.
So we
I
need to
like how
remember
she
that.
yeah, she's so positive. But she did say, which I wanted to mention, she mentioned Medicaid. And I wanted to make sure that our listeners know all of that varies by state, location. So I don't really want to get into the details of it. But I just want to encourage you to get that process started early. A lot of people think I'm going to wait till my kid is older. We don't need to worry about it now, but get the process started early.
Yes. Yes.
That's good. Yeah, because it is a process for sure. So maybe that's an idea for an episode later that we could talk to somebody who could tell us more about that.
That would be great. Yeah, I think a lot of people would enjoy that. I think I would too, because there are always questions I have when people ask me, and I'm like, okay, what is it again? What do you do again?
Yeah.
So, yeah.
For sure. Well, and she always is good about. I have had her come to speak in one of my early childhood classes before, because I think it's really important for future teachers and special educators to know that, there are kids that have significant needs, and these we have to teach you how to do this too. And I remember Amanda's first slide has all the people that do all the therapies that she goes to, and there has to be 12 of them. So I can't even imagine having all that on I know she has lots of help with family. That was one of the things we were going to talk about too, right? Was how she encouraged family to be part. Paige, how do you feel about families participating in therapy?
I love it so much. Every time that another family member joins, maybe it's an aunt or an uncle or a grandparent, I love being able to help, family members to feel comfortable and ask questions and things like that, because those people are going to be part of your team for the rest of your child's life. And so that, just encouraging your family to come and surround you and, learn about all the things that are part of your child's life, and maybe they can learn some strategies too. I know oftentimes like family get-togethers are sometimes a struggle for kids with special needs, and think about allowing your family members to be part of some of those home visits or therapies and things like that, I think can help. But even too, I love whenever siblings are part of it. Some of my families will talk about how it's going to get a little bit crazy, or sometimes it's loud and there's kids running around and things like that. But if that is your typical daily routine, as a teacher, I like to work within the typical daily routine, because it's good to be able to see how your child participates and how we can use all of those things that might feel a little bit chaotic really to our benefit, to encourage everybody in your family, and also just encourage everybody to work together and love each other more, and all those like happy feeling sorts of things. But it really is good stuff. So another thing too that I like that she said was taking a break from therapy sometimes, and how important that can be. So Jenny, I'm curious about with things in your family, if that's ever been something that you all have done, and how it impacted your family dynamics and Hannah and everybody.
Yeah, we always try to keep vacation as something that we do each year. We feel like that's really the only time that it's really just our family, and we really try to protect that. So even if that means rescheduling doctor's appointments or therapies, we really try to do that. We also, I thought this was something bad that I did, but it turns out now I think that it would have been worse if I didn't do it. When we were during COVID, when we were in lockdown and we were doing school from home and therapies from home, we just kind of got to the point where we were trying to work and do therapy. I couldn't manage the girls' schoolwork. They were still young, so I was still with all three of them, having to sit with them and do everything. They weren't very independent, especially the younger two. And so it finally got to the point where I just had to say, hey, I need to stop therapy for the next month until school is out. We can't do it right now. It's too much for us. And taking that off of our plate was huge. It just made everyone just kind of calm down and feel like, okay, we can survive this. So taking that break, and I like was worried about it. And then even after I took a break, I feel guilty about it. And I was like, oh, this is going to be so detrimental. It wasn't. So yeah.
I love that. And piggybacking off of what you said, therapy and early intervention and your home visits from your providers, they're supposed to make your life, or at least help you make your life a little bit easier.
Right.
And if that's not happening, then it's okay to make some changes, because we're not there to stress anybody out. I know just the nature of it sometimes can be stressful if you have somebody in your home or you're trying to get somewhere. But if it is making your life feel like it's just kind of passing you by and you're just trying to get all the appointments in, it's totally okay. And I love how you're encouraging people, Jenny, to do what makes you feel like you have a full life. You don't have to do all the things. You know, your number one job is to be your child's parent. So I love that.
I do wish someone had told me from the beginning to not worry so much about vacuuming my house before they came. Because at first that was like a huge thing. I was like, oh my gosh, they're going to think that we're terrible. And when I finally realized I couldn't keep up with that and I couldn't try it all, it was so freeing. I'm sorry. Do you need a lint roller on your way out? Like, I can't keep up.
Well, I think all of us have that. And I don't know if we could have told you that. Sometimes there's things that you just have to learn on your own, that people aren't going to stop coming if your house isn't vacuumed. I always used to tell families that I'm not here to see your house. I'm here to see your kids. So I don't care what it looks like. So, you know, my house isn't perfect either. So that I think, but I'm not sure that's something you can tell people. I think you just have to learn it. But all these things happen.
I'll also say, you know, in some ways around the like clean home, when families are allowing me into their home, I actually feel more loved and flattered when someone hasn't vacuumed their house than if I come in and it's pristine and clean, because that helps me know that they feel that I care about them as a person and I'm not there to judge, because really I'm not. Like your house is a home no matter what it looks like. And it actually makes me feel better if somebody's house is not like completely picked up and cleaned and things like that. So just an encouragement to anybody out there that thinks that they need to clean their house. The Paiges of this world actually feel more loved. And
that's a great
all
point.
Those things if you don't.
I love that. I think that's going to be my new motto. Make everyone feel at home. Stay messy.
That's right. That's right. Absolutely. Well, we should wrap this up. We've been looking at the survey results in the show notes, and you've been giving us some good feedback on what other subjects you would like us to do that. And since we're starting to talk about what we're going to do for next season already, please continue to do that as often as you can. So,
thank you so much for listening to Feeling This Life. Please consider subscribing to Feeling This Life wherever you get your podcasts. And please take a minute or two to give us your feedback and your ideas for future episodes by completing our survey, which is linked in the show notes. There, you'll also find ways to get in contact with us, and you'll find resources related to today's episode. Please join us again next time for another episode of Feeling This Life.